The federal government's decided to come to the aid of many Australian women facing a potential health time bomb. It's agreed to spend millions of dollars subsidising scans for PIP breast implants. The French manufacturer is being prosecuted for making substandard implants to save production costs, and the government there is paying for French women to have the implants removed. But here in Australia, authorities have come under fire for their slower response. Deborah Rice reports.
These are the poly-implant prostheses suspected of being filled with industrial-grade silicone instead of more expensive and safer medical-grade supplies. From Monday, Australian women will be able to get a Medicare rebate for MRI scans to check whether the implants are leaking.
They must talk to their doctor, to their medical advisor, to their surgeon and determine the best course of action for them.
It's not enough, but this will save women an enormous amount of money and give them some peace of mind.
So far in Australia, there have been almost 200 reports of the PIP devices rupturing, but thousands of women who had implants when their breasts were removed or enhanced don't even know what type the surgeon used. And like Darlene Watkins, who spoke to the ABC a few weeks ago, finding out could come too late.
The one that was ruptured, the actual shell was decaying. The other implant, he called it a bleed.
Her surgeon has found problems with around 20% of the implants.
It is disconcerting that the still public TGA, which is our regulatory body, is still saying that the rupture rate is within acceptable limits. It's clearly not.
French authorities recalled global stocks of the implants in 2010. Then 3 months ago, they recommended all French women have them removed and agreed to pay for the surgery. The Australian government says there's not yet enough known about the health impacts to justify that approach.
Every time someone has surgery, there are risks in having that surgery. So we're not at this stage in Australia recommending routine removal.
But what happens if a rupture does show up, or problems start after the 12 months of subsidised scans?
The government should be paying for any woman who wants to have the PIP implants removed.
There are also calls for a compulsory register of recipients and for mandatory reporting of implant failures. Deborah Rice, ABC News.